Hello, everyone. Welcome back to another One Mission DMD podcast conversation video. This is going to be part 2 in the video that we did sitting down with Dr. Jordan Barnett, who's been out of dental school for about 2 years. So this is going to be part 2 in that conversation. Thanks for coming again, Jordan. Appreciate the time.
Absolutely, man. So excited to talk dentistry, especially with dental students and anyone going into the dental field. Like you, I got my butt kicked super hard all through dental school, and I was wondering, oh my gosh, like, am I going to be good enough? Am I going to do it? And I can tell you that you are good enough, and there's a reason why it's so rigorous, because if you can get through it, you can get through the dentistry. And so what we were talking about at the very end of last video, we got cut off because I probably goofed on the technology. Teham is amazing with this stuff. It's so amazing to work with him. I don't even understand half the stuff. But anyway, what I was saying was, is it wise? The question was, is it wise for first years to look into private practice? I think it's super wise for any dental student to look into all the different types of offices in the dental marketplace: corporate, fee-for-service, private practice, PPO, HMO, Medi-Cal, Denti-Cal, right? All the different types, and see that there's differences in each type. Every type is super important because it makes up the dental marketplace, and you are the dental clinician in the dental marketplace. So of course it's important to look at everything. I thought private practice was for me, and maybe it's not for everyone, just like the other types maybe not be for everyone else either. So is it super wise? I think it's always wise to be looking at what is the next step for you. So yes, 2 thumbs way up on looking into private practice opportunities or any other type of opportunity.
Okay. So what would you say to someone who's maybe like, having practiced for 20, 25 years, seeing the new dental students coming out and, entering the field, and they have all of this debt? And the common argument that a lot of people have is that are you sure you want to take on even more debt, after getting out of school and then going into private practice? What would you say to that type of person to kind of, maybe share something they don't know?
So that's a great question. Like I said, I think for me, when I looked at my career and the things that I wanted, right, the type of dentist that I envisioned myself as, like, I always had sights on owning my own business. I really am interested in business. It's a great point about the student loan debt. I mean, I went to University of the Pacific, and I have about $500,000 in loans. So yeah, that's obviously a pretty important thing for me personally. I have no problem sharing that because that's public information at this point. And yeah, I borrowed the maximum. So yes, that was a big consideration for me. Like I said, I really do encourage, especially while you're in dental school, students to look out at the dental marketplace. What are the differences, like I mentioned in the last question, between, a fee-for-service practice or a FQHC or, teaching at a dental school? There's different modalities of doing dentistry. And I think that there's a place for everyone in dentistry. We need all of us because the United States is underserved as far as I'm concerned in the realm of dentistry. So we need all of us to contribute, and there's a spot for everyone. So is private practice for everyone? No, I would definitely argue that it's not. I guess if you think about the mindset of a patient at a private practice office, this is someone who values dentistry, right? Like they've seeked out a private practice dentist that either takes their insurance, and if they're fee for service, that they're willing to pay more than they would if they went to someone who had insurance, right? They're willing to pay for something that they believe to be quality. And so, of course, if they're paying more, it just kind of comes along with the expectations, right? Like you wouldn't expect a cheaper car to perform, let's say, as good as a more expensive car. So there's different types of dentistry. And I think it's very competitive. I think private practice, when you really think about it at its own, is you have people who are interested by people, I mean the people that are drawn to it. In my own estimation, is people that are interested in business, people who are doing dentistry, and they're always looking to improve and get better and provide their best dentistry that they can, right, to a small community of patients that they build, right? So they want to do dentistry on their terms, which I think is cool. And I think that patients are great beneficiaries of that because that does inherently create competition. Now, obviously, that opens the door for bad things to happen. There's a lot of bad dentists that make a lot of bad choices, unfortunately. But at the same time, when I really think about private practice dentistry, it's, for me at least, I really enjoy trying to put out the best product that I can do. I'm a new dentist, so at this point I've done about, I don't know, probably 2,500 composite fillings, right? And every filling is getting a lot easier. It's getting a lot faster. It's getting a lot smoother, but I'm always looking to make it faster, because I made the point in the last video about the oral surgeon who said, Doc, it only took you 90 seconds, $1,000. And he goes, yeah, well, the guy across the way, he charges the same and it takes him 90 minutes. Like any procedure that you do short of orthodontics, right? Because that really is kind of it's a field of its own. But any procedure you do, like if the patient could pick, if the outcome was the same, they would choose it to be faster. They would choose it to be a little bit more comfortable, right? At some of the offices I work at, they put headphones for the patients. They give them visuals, things to look at. Like, again, because we want to provide the best service. And in private practice, you're willing to put your own personal name and reputation out on the line in order to say that, we provide a good service. Versus if you worked at a dental school and you're a provider there, that isn't necessarily as much centered on you. And obviously it takes away the idea of business ownership in that component. So it's not for everyone. It's very difficult as far as I'm concerned. I mean, dentistry is difficult, let alone, talking about the different types of dentistry. But I think it's a great pathway for me. I'm really, really fulfilled. I think it's created a lot of growth on my end, and I'm tremendously happy about that. But it is not for everyone, that's for sure. How do you find out what's for you? You go out and you go talk to people. You go shadow, right? It's different. It's not like shadowing for dental school, because you don't know what the heck you're looking at. You might say, wow, that was really cool how he extracted the tooth. You don't understand, okay, he used that elevator? No, at school I like my curved elevator. I think that works better. I use a spade elevator now, thanks to one of my mentors. That thing, I'm telling you, is the best dental instrument I've ever used. Again, the things change and adapt, and of course, you're always looking to get better. So that's what's really interesting about the private practice market is you are usually paying the most or using the most expensive materials, because these people are the dentists that are buying that market for these supplies because they want to elevate their game in some way. And so it's been fun on the private practice market seeing how really intelligent dentists are investing in certain technologies and certain materials, right, in order to deliver what they believe to be a better product and to hopefully grow a business based on a good product, which is the service of good dentistry. And as far as I'm concerned, what I wanted to focus on was doing the best general dentistry that I can. And it's been, honestly, I love it, and it's a passion of mine. It's fun, and it's very difficult, but a great, tremendous choice as far as I'm concerned.
Dude, that's the beautiful thing about it, and I think you're absolutely right that private practice, associateship, all this stuff, it's there, and there's so many avenues for people to pick, and that's the wonderful thing. You can go in whichever direction you want to. So that I think that's there's always a bunch of doors, and you just have to open the one that's best for you after school.
I just want to say I agree with you 100%, Teham. I think that is extremely wise of you, and I 100% agree. And I think to that point, I'll just kind of add on to that and say that, look, what can't be taken away is the knowledge and the degree that you have from dental school. That enables you to practice dentistry in whichever manner or form that you choose to. And I can tell you that for me, at least, having worked at so many different places, what I really noticed in myself, and maybe this is anecdotal, but that was just for me, was it did give me a lot of different aspects of dentistry that maybe I didn't think of. Maybe one, even though it's general, one dentist that I work with, he does a lot of endo. So I just really, really focus on a lot of endo. One dentist, he just focused on speed. Like, man, this was the fastest dentist I've ever seen. I'm talking a crown prep in like 3 minutes flat, like no problem, like just insane, right? And his patients like that. And he wasn't a talker. He did it, like, again, I mentioned the personalities. Like, that was the first guy I worked with. Look, he's an excellent clinician as far as I'm concerned. He's excellent. And, he has a patient base that really appreciates his speed. Whereas other ones, maybe they want a doctor who kind of talks more and takes their time. Like, it's different types of, it's the same thing. A crown is a crown. A 2740 is a 2740, right? A full coverage porcelain crown. How that crown is delivered, the service and the way, the concierge level, right? The speed, the timing, the price, everything, that's all a variable. And each private practice can provide a little world, if you will, of the practice of dentistry. And so it's really interesting. And what I've noticed is that I found things that I loved and I found things that I hated, right? I'm working at so many different places. Like, you can tell that your mood changes. And if your mood changes or you're not enthusiastic about being at a place, i.e., let's say private practice isn't for you. You feel like, you know what? This is all about money. I don't like that. I don't think it is, but some owners do make it like that, unfortunately. Or, maybe it's just not working for you, right? Like, you're not going to be happy. You're not going to be excited by the dentistry that you do. And what results can we expect from a dentist who's dissatisfied with their job, right? And like, that's not fair for the patients. But like, not only that, you did all the hard work. You have the degree. Make sure that you're working in a job that you're fulfilled in, because by being in a job that you're fulfilled in, you will in fact do the best dentistry that you can.
You talked about the money and how it can, and the timing, and it's different for everyone. How that actually leads me to the next question. How do you we're in dental school, we're taught conservative dentistry. And if someone goes into like an associateship with like a huge dental corporation where they really push the numbers and they're pushing for treatments, how can like a new grad kind of balance the two disciplines and kind of make sure they're doing what's best for them and their patients?
I can tell you this, in the court of law, if you are the dentist that is providing the service where something went wrong, you and your license are liable and responsible. So if you are taking a job and you are engaging in a dental procedure and you are the dentist in the scenario, like I said, it's your responsibility. So I did work at a private or a corporate. I worked for Pacific Dental Services at Clovis 2, 373 with Dr. Pablo Rigor. He's the owner dentist. And that was the most amazing experience ever. It was incredible. I was never pushed to do things. And I also made a line up front. And I said that exactly to the people who hired me. I said, look, like at the end of the day, if I'm in an appointment and this is the dentistry that I want, that's the dentistry that I recommend. They're welcome to go get a second opinion or see another doctor in our organization, but that's what it is. And I was never pushed on that. So from Pacific Dental Services, PDS, I think it is absolutely an amazing. I will always recommend. Good idea for someone who maybe they don't know what they want. Like, believe me, what corporate's going to do is it's going to keep you busy. I can tell you that. And if you're looking to, hone in on your skills, if you're looking to maybe increase your speed, like that's a good place to do it. And you got to understand, from a business standpoint, there's a reason why they've become successful, right? Like there's a reason why thousands, hundreds of thousands, millions of patients are going to these places, right? Because the patients, right, are making the decision to go for something that they believe is of value to them. And if you're a good dentist and you're a good person and you work at Western Dental or Pacific Dental Services, you are the dentist. Pacific Dental Services was not the dentist. They were the place, they were my employer that I had a relationship with, from a employer-employee relationship. And in that relationship, my duties and responsibilities were to do the best dentistry that I can. And so at the end of the day, if you were working at a corporate, yeah, there might be some pushes. I don't know. I can tell you that I never had any. Of course, there was goals, and I think it's important to have goals. I think a lot of people, for example, at dental school, when you're looking at, what's your production on Axiom, blah, 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 and you can get into this competitive thing, and it's like, well, that's really messed up because you're talking about patients. Like, well, hang on. Let's make the assumption that the dentist that we're talking about is like Teham. He is an amazing guy, and he is moral, and he only does the dentistry that any other dentist would agree, yeah, that needs a crown. Yep, that needs an SRP. Yep, that needs whatever. Look at where the corporate dentistries are. They're in places where there's disease, like actual disease. And so, you know what? Yeah, to have a goal, like maybe they might have production goals or things that they want. It's like, it's not like they slap you on the wrist. Maybe they do, maybe they don't. I can tell you that was not my experience at all. If anyone watches this, but I'll also, again, like I can tell you that I would never be pushed. Like, I've had 5 associateships or places that I've worked at in 13 months. Right?
That is so crazy to hear, man. That means you were doing something right. Like you kept finding better opportunities as they, presented themselves.
And I'll say this harshly, but with love, right? Is if you tell me there's no jobs, I will tell you, you need to look harder, and they might not be job postings, right? And let's talk about it. Maybe it's just strategy, right? Like it's crazy to me. I think that in school, like, we just get so wrapped up in school. That's what I love about us being dentists, right? Is we're just committing to excellence, but we don't understand the procedures, the processes that are involved with finding a job, finding employment, right? A dentist without a job is just a weirdo who just looks at teeth for a living. right? Like you know, or not a living, I guess, right? Like you need a job, you need a place where you can do this stuff, and if you really love it, you know, and I would hope you love it after all that school and all that time and all that energy that you put into, you know, mastering this new craft. But I guess what I'm saying is when it comes to the, you know, corporate thing, I had a great time. It was great for me, right? And I think that it is a tremendous opportunity for a lot of people. But you know what? If you have low morals, or you're weak-minded, or you get pushed around, like, it's awkward. You know, it's really awkward to tell someone like, no, I disagree with you. But again, like, any dental procedure you're in on, you are ultimately responsible. So if you get pushed or you get shoved, like, you can find another job. And believe me, like, if there's anything I'm committed to, it's making dentistry better, making the public's perception, which they have a low perception of us as dentists, it's making it better. And the way we do that is we make dentists like ourselves find places of employment where we're encouraged and we're doing a good job and we are best serving patients. And so by you, if you're watching this video and you're thinking about the next steps, like, all I want is for you to be happy and to do the best dentistry you can. You're not perfect, no one is, but it has to be systematized in how you approach your job employment. And believe me, I was very sharp at knowing what I wanted and what I didn't want. And you're the dentist ultimately. You have that ability. Like, you are, you know, you're a star player, and they know that, and they know that you have the potential to make them a lot of money and make a lot of money yourself. And or at the end of the day, it's a huge responsibility, and so they're looking for the people that they think are the most responsible. And so by being proactive in this job hunt, and we can go over strategies on how to do that, right? You can definitely find places that really do give you the push, the motivation. And I can tell you that I'm not a perfect dentist. I never will be. But in the last 13 months, I'm really proud of the accelerated pace that I feel like I put myself on. And that's because I made good partnerships with good employers. And I'm happy to share more and kind of talk more about all that stuff as it goes on.
I love this conversation. It's just naturally flowing into whatever we need to talk to. So that's exactly what we're going to get into now. The next question was, how can a graduating dental student make sure they're setting themselves apart in that job hunt? Like, what would be something you also think that students typically don't do for the vast majority of people?
Think about it like this. Think about it as if you, the dental applicant, so you're a person who is a dentist or dental specialist and you're looking for employment in the dental field, okay? And so, or sorry, not employment, but you're looking for employees, i.e. dentists or dental specialists, to come work for you. That, you being the employer or the manager or clinical director or whatever, that is a tremendous decision. That is a tremendous decision. Why? Because we have the ability to make tremendous errors that financially and legally put people at risk, right? And so this is an important thing to consider, especially when you're brand new out of school, right? Because it's like, dentistry unfortunately does have that thing. Like, you know, you got to think about how much school we went through. Naturally, what we're going to be is skeptical, right? As trained scientists, right? We have to be skeptical. I have to listen to a patient and say, okay, like you have to sort through information, right? I guess is one way to say it, right? And so you're a brand new dental student, and a lot of the dental community has been really upset with where they believe dental education is going. So you now have someone who has 20 years of experience on you. They think you're coming out of a school, which they think the school system is declining. And you're over here saying, I've done 4 crowns. Like, that doesn't look great, right? Like, right? But then you say, but I was really good in sim lab, I promise. Like, that, if you're them, you're like, okay, like, are you going to hurt someone? Like, do you know what you're doing? Right? Like, this is important that you know that. And like, again, this is, just remember this. If you're graduating dental school, that means that the licensing boards, right? If you're from an accredited school, that means the licensing boards have determined that your school is proficient at training dentists. Are you happy with the amount of crowns you did? Maybe not. I prepped and cemented or cured 1 EMAX, right? Bonded. I did 9 in dental school, and I prepped 11. It's not a whole lot. I did 64 fillings. I did about, I think it was like 200 extractions, and I did like 6 root canals.
Actually, no, I have to say, I did part of a root canal on one of 6 teeth, and then I did a full root canal on 5 other teeth, right? And so that's not a whole lot of experience, but what I did is I made a portfolio. And if there's anything that I'll sound like a broken record on, anyone and everyone that is listening, especially if you're looking at getting a job, is put together something online. Put together something that you can send me an email and I can look at it from the toilet. And I know that's pretty funny and weird. Why? Because these are dentists, right? They're like us. We're machines and robots. And what do you mean by that? I mean, you can take a test every other week with 1,000 PowerPoint slides of information and somehow manage to memorize all of it. We're machines, and so we're constantly consuming information. We consume it quickly. And we're dentists. We like technology. We like tinkering with things. And especially if you're an older dentist, maybe you don't feel comfortable with technology, but you're looking at this younger generation as, oh, you guys are great with technology. Make a Google site. It's free. I guarantee your school gives you a Gmail account, right? Make a Google site. I did it for free. I mean, well, $500,000 if you consider that I got it through my school email, but it was included in my tuition that my email. Also, they bought the Google package where I was able to make a Google site. My portfolio is a Google site, and what it is it's a highlight and a hallmark of all of the work that I did in dental school. And I can talk through every single of the 200 slides on what I did, what I thought here, what I think could be better, what was my total treatment time when doing this. I remembered all this information. What dentistry is at a fundamental level is you as the dentist need to be able to thoroughly convey information to patients as well as to your team that you're working with, right? And so if you're not proficient or you're not good at giving out information, right, then it's going to be really difficult. I don't care what type of dentistry you're in, right, to be successful, because patients don't understand what you're doing. They need to be explained these things. Your team needs to understand where you're at. So communication is important. What a portfolio can do is it communicates a lot of different things to a future employer. It communicates, one, that you care. That's so cool, man. What do you like better? A resume on a piece of paper that you're looking through on a desk with thousands of bills? Do you know how much stuff dentists, especially owners, or anyone, any dentist, right, how much paperwork they have on their desk? We're part of medical legal. Dude, there's so much documentation. You don't want to see another paper, but to look at a website and that it's well done, well polished, it's thought through, right? It shows a lot of different things in terms of a maturity standpoint, which, again, if you have 20 years of dental experience and you're looking at someone fresh out of school, as the person with 20 years of experience, you're probably you don't know anything. I know so much more than you, because they're learning every day too. That's how large of a compass of responsibilities that we have to people and to our career is there's so much, and they're just looking oh, you don't know what the heck you're doing. But if you can show wow, okay, that was pretty smart. Why did you use this material over this material? And what's cool is, then you can have a discussion about your portfolio. They're oh, what'd you use? Oh, you use Reliax for that cement? I like Fuji better. Oh, and you can say, oh, Doc, why do you like Fuji better? I get a better deal on it, and I think it works better in the hundreds of units that I've done. It's okay, yeah, great. Well, Doc, I'm really excited to, I want to learn more materials, and you're a business. That's what I like to also about private practice is these are businesses that are run by one person. And so their material choices are going to be business decisions. And so it's interesting to look at it from a business owner standpoint. Why do you use this cement over this? Is it because you're being cheap and it actually is a suckier cement? Or do you actually think that in your working hands, you're more profitable and you do better dentistry with this material? Oh, interesting. Why? And now they're teaching me how and why they use it. And so now I can start to mimic their results on different materials. So the ability to have all the different materials as a general dentist is everything. But long story short, what I'm talking about is when you're engaging with an employer, right, or someone that you want to work for, you have to remember that you're asking a lot for them to consider you for employment. And so I think it's only fair that you show them that you are knowledgeable and competent. I'm sorry, they have a degree just like you do. So what? It's a piece of paper. They weren't the ones that went through the 4 years of hell like you did, right? They don't know how hard it was. They remember how hard it was for them, and maybe it wasn't hard for them. And again, they're over here thinking again that our education is not as good as theirs was, right? And not only that, what we get to show is, especially, this is what I think. If you want to work with anyone, you got to work with people who love dentistry, man. people that don't like dentistry, it's just a job to them. They're going to see you as just a nuisance. They're going to see you as this big caution symbol. And they're like, don't let him or her do anything. They're an idiot. No, it is going to be more work for me to clean up if they mess up. But if you have someone who loves dentistry, a great sell is, me now as the applicant to the person employing me. It's like, look, what I can be is I'm a window. Do you remember what it was like pulling your first tooth in private practice? Like, that's exciting, man. Like, to really be out there, do your first crown. Like, you are a window into, wow, okay, like, what's new in your training that you didn't get? Because, again, like, I paid $500,000 for school. Maybe the guy who has 42 years experience, he paid like $60,000 for all of dental school. Right? Like, how's it so much more expensive? What new things did you learn? Did you guys do gold foils? No, we don't do gold foils. But we learned CEREC. Oh, yeah. I can't even believe that CEREC exists. How does it even work? Let me tell you all about it, doc. Right? Because you are now, again, you have to be competent.
For the listeners, just to kind of, talk about that portfolio, when I first connected with Jordan, he shared his portfolio with me, and I was amazed. I didn't even know that this is a thing we could do as dental students. I just want to say, like, it's not, when he was talking about the Google site, when Jordan was talking about his Google site that he made for employers, it's not just like a picture with words of stuff he's done. This was super thorough. He had a presentation with like the isolation he did, with the preps that he made. He had pictures of the preps before the restorations and then the restorations done. Not only that, he made a video going through the entire thing for everything from endo to pros to operative to everything. So, what you did, Jordan, I think is like the perfect model. And this is just a plug, and I'm going to definitely put that in the description with your permission,
Sure.
obviously.
Yeah, of course.
If everything checks out. But I think everyone should do this, and I 100% agree with you. It's really just going to show who you are. They're going to hear your voice. They're going to see your work. That's way better than, like you said, reading a resume.
It's like, oh, man, you enter an interview. They're looking at it like, okay, what are you good at? And as a new grad, relative to them, you're not good at anything, right? But it's like, what do you say? Like, oh, I was the fastest in sim lab. Like, I don't care, right? Like, that doesn't mean that's insignificant to me, right? Like that's not a tangible result. Like, what are you talking about, right? Like, okay, how long does it take you to do a crown? Well, in the 8 that I did, I think I averaged like 5 hours, and it's like, yeah, I need you to do a crown in 10 minutes. So that's not going to work there, And so like, but by showing that you have a baseline understanding of everything, again, you talk about the isolation, the everything. It's like, what I'm showing to whatever provider, right, that is looking to potentially engage in a employee-employer relationship. I'm showing that, like, hey, like, I'm responsible for myself, and I know what the heck I'm talking about, right? Like, let's be honest. Some people, want to see grade point averages. Like, look, I have no problem admitting, I had it below a 3.0 in dental school. Like, I really struggled, especially in the sim lab. Like, and I kicked butt, man. Like, it took me a while to understand that, man, I'm just not like good at this, or it's just going to take me more practice than everyone else, maybe. Like, dude, I didn't do very well in the PAT, and I think that there's a reason why we take it, because that understanding in 3 space of how structures look, like understanding line angles, understanding all these things that are important for the success of whatever. I mean, I'm a general dentist, so I'm going to think from a restorative aspect, right? But what I'm saying is, yeah, it took me a while to understand that. And so that was feedback that I got. And so I really looked to improve. So the portfolio didn't start actually with the idea of a portfolio. I just started taking pictures because I was like, all right, I want to take a picture, zoom in on my damn screen so I can look at it for 3 hours and be like, how did I look at this differently? Or like what did I not catch? Like, Jesus, like, why are all my classmates prepping crowns so much better than I am? And it just took me time. But like, so the photos and everything that I had for the website, those were just for me to get better. And not only that, I was excited. Like, you go take the DAT, you go through undergrad, you worry about getting into dental school. Like, it's so much work. It's so difficult. And it's like, dude, I did it all so I can do dentistry. It's like, so now I'm in clinic. It's like, of course I want a picture of my first tooth that I extracted. Of course I want a picture. Like, this is a monumental thing, right? Like, pictures are, I'm also a photography nut. So there's bias here. But what I'm saying is, like, this is a snapshot in time when, like, wow, like I've done, 500 crowns now. Right. So like, it's not the same as my first one, but like to have a picture of it is really cool. And so it started with, I had this bank of like 4,000 or 5,000 photos, and I was thinking about getting a job, and I was like, okay, again, I started with what I or I started with the mindset that I said earlier in the answer to this long answer of a question. Thank you guys if you're still around. I hope this is helpful to all of you, right? But
it's helpful to me. That's all that matters to me right now. So I'm chilling.
good. Okay, good. Well, thank you, and thank you for anyone. Teham does a tremendous job, so glad that you guys are here. But what I'm saying is again, like I had all these photos, and I thought with the mindset that I told you to think with is like, okay, if I'm an employer, right, and I think that dental school sucks or they're not doing a good job teaching dentists and I'm a brand new dentist and I didn't do a residency, how do I show you that I actually know like a general idea of what I'm talking about, right? Other than saying like, yo, I was really good at crowds in dental school. It's like, no, you weren't. You did 8. Like, you know what I mean? Like like, and I don't mean to be critical. Like I did 9. Okay. So I'm not like putting you down. Like I think the top person in my class did like 40 or something like that. Like that's a lot, but I do 40 in a week now. You know what I mean? And so like, and then, I'm only 1 year out. So there's dentists that are doing like, dude, they're doing like 60 units a week. So it's like you're 40 while in your class was good relative to the real world. That might not be anything. Like that might not be anything. You can say, oh yeah, like what are you good at? Well, I'm really good. If the person interviewing is saying, what are you good at? You say, well, what I'm really good at, man, is I'm fast. I'm super fast. Like, oh man, I'll pull a wisdom tooth in like 30 minutes. It's like, dude, I can pull all 4 in 10 minutes. Like again, I'm not saying that to say, look how good I am. I'm saying because I've been on the private practice market for 13 months now with working with what I would argue from a clinical standpoint are the best of the best in my local area of over 1 million people population wise. So like, you got to understand, like I've been working with people that push me, that say, hey, you know what? You could have done that a little bit quicker. Yeah, you're right. And again, I can tell you right now, this is an important line for any dentist that's looking to get a job. The best line is, look, I'm always open to feedback, and just understand that whatever feedback you have, especially if it's critical, like you'll never be as hard on me as I am on myself. Because you have to be looking out for that. If you're going to run side by side with someone who's a dentist, you better hope they're like that. Or else, you know what? The name of your facility, your personal name as a dentist because you hired them, now that goes down too. They're making a huge gamble on you. And I tell my bosses every day, like, thank you for the opportunity that you gave me, right? Like, understand that I understand, right? Like, how important this relationship is and the gamble that you took on me. Like, I want you to know every single day that, like, it was a good choice that you made, right? And, like, and if there's something that you don't like, tell me. Like, I'm always looking to get better or improve. And I think when you have a mentality like that, of course it's going to go well, right? Like, that's just naturally charismatic. Like, people love to hear that. They like to see you do well. Right. And again, like if they're employing you, right, or they're managing you, they have a vested interest in your success, or they should at least, right, because they're paying you and or they're directly responsible for you. So of course they have a vested interest in your success. And so with all these factors included, you as the applicant want to show that I do the best job that I can. I will get better. I love doing what I do. I'm happy to take responsibility for my mistakes, and I'm open to feedback always. And I'm not lazy. If you can say those things, that is an extremely compelling thing, along with a portfolio like the one, that I was able to make. Again, I'll be happy to kind of explain to people, anyone that wants to reach out, how I made it. It wasn't hard.
All right, so that leads us into our next question. It's kind of a challenge for dental students or new dentists to evaluate their worth, and when it comes to salaries for when they're looking for an associateship. So how can one go about that exactly and figure out, what kind of an offer they should be accepting straight out of dental school?
Look, when it comes to, what a new employees or a new dentist, right, what are they worth? That depends on your productive capabilities. Because remember, like, if you can produce $6,000 in a day, I mean, like, 3-4 units of crowns, you can do endo. And again, what's the area that you work in? In Fresno, California, where I'm at, it's a very underserved population. And believe me, there's a good amount of disease. I'm doing like, if you're a general dentist in Fresno, in my personal estimation, right, the ability to be competent in endodontics was extremely important for me as a general dentist in Fresno. And so by being able to offer that, right, like that increased my productive capabilities as well as it made my stock or my value go up, right? And so in all the different jobs that I worked, right, I obviously I wanted to increase my capabilities, and I put myself on like almost performance plans with my boss, right? Like, hey, these are my goals. This is how I'm going to track my goals. These are what I want to be doing every day, right? Things like that. And so I've just been really open and honest about my communication because of that, right? That's why so many people that you see, they're, what do they get paid? They get paid a percentage of collections. They get paid a percentage of production, right? Just remember that, like, for me, like, when I first started, that sounds great, right? But it's like, okay, if you make 30% of what you produce and you produce $1,000 a day, you're making $300 a day, right? Like, that's not very good. And so you have to be honest with yourself on, okay, what kind of practice is this? Is it crown $2,000 or $600? Because that's really going to depend on a lot of things. You know what I mean? That's going to substantially change where you're at. How good is the office at collecting that money? I don't know. Because you remember, like, your job is to, put your foot on a rheostat and cut some tooth. It's the other people's in the office's responsibility to collect on the money that we produced. So it's like, for me, I was like, well, I don't want to have to be my own accountant and figure out every day on top of doing the dentistry how much I'm owed. I'm like, no, I think a per diem makes sense for me. And again, that per diem was enough to, be financially viable for me and my partner. So a per diem, for those who don't know, per diem is Latin per day. That means like, okay, you're going to pay me a base rate for every day that I work. That means I can produce $0 and make that much, or I can produce $1 million and do that much. I can work 6 hours, or I can work 16 hours. I'm going to make that amount. So that's why, like, I'm a huge fan of per diem. I think it makes a lot of sense. There's no calculations. And again, you might have a dentist say, well, I'm not going to pay someone if they're not going to produce. It's like, again, if you take a job as a dentist and you think that it's okay for you not to be with a patient or to have no schedule for 3 hours, you are the most expensive employee. And from a business standpoint, you make no sense. So again, like, I'm saying that toughly because it's like, if we don't understand these things, like, that's how you look naive. Like, I don't want us to look naive. You are a trained dentist, right? Like, you have to go in with the understanding that, like, yes, like, there's expectations that are had because you're the dentist. They should be the highest. You can't have your cake and eat it too. Do you want to be named the doctor? Yes. You better take responsibility, right? And so your abilities as a producer are important. What you can do, though, is, because the question is, how do you determine your worth? Call the dental society. Google Houston Dental Society and talk. Like, these are people, right, who work there that aren't dentists, that are just there to support the dental community. Get some help. Get organized. Like, talk to people. Talk to dentists. Tell them what you're able to do, right? And again, if they love doing dentistry, they're probably successful at it, 1. 2, they probably would love to teach you, right? And 3, they can make more money by you making money, right? And by producing. And 4, if they're as successful as they are, they probably have the patient load to keep you genuinely busy, right? And so for me, again, a per diem was nice. It's a safety net. It feels good, especially if you have all these different factors, like you said, you have this high debt, right? Like, how do you pay for things, et cetera, et cetera. Like, you want to know that, like, okay, I'm taken care of. That way you're not cutting teeth and be like, oh, this small E1 lesion looks like a crown. It's like, no. Don't do that, right? Because dentists, unfortunately, if you're paid by a percentage, it can promote bad behavior. We all know that. That's just dead true. And in the corporates, that's how it happens everywhere. We get paid for doing dental procedures. Some procedures pay more. And some people, dentist people, take wild advantage of that. That is your own morals and codes of ethics. And I think that if you allow, right, those types of things to alter your decision making, I think you're bad. I don't care how close your margins are. That's bad. That's not good. So for me, like I said, I told him, I was like, look, I'm still learning the dentistry. Like, I just need the ability to understand I'm taken care of from a financial standpoint. Like, I'm like, remember, we didn't do this with lawyers. We didn't do anything like that, right? And I was like, I'm just going to come in and kick butt. And I was like, I'll take the emergencies. I don't care. You know what I mean? Like, I'm not thinking about me. Like, I need to be paid this money because I can't survive or eat without it, right? And I'm trusting you that it will be correct and accurate. I will be letting you know if it's inaccurate, right? And again, you're my employer, so you should hope that it's accurate, right? Because if I've dutifully done my job and performed my job responsibilities, then I would expect to be paid the amount that was agreed upon. This is an amount that I can work for. And so if that agreement's there, right? Like, yeah, I told him, I was like, other than that, I'm not going to be thinking about these selfish things. Like, my pay will go up as my production goes up, and it sure has. And so, and for me, I'm in Fresno, California. I'm in the local PPO market, right? Every day, my goal is to hit like $3,500 in production. That doesn't sound like a lot, but again, a crown's only $646 out here, or in a PPO schedule. So it's like, you're talking like a lot, you're talking an average of 10, 12 fillings, mostly class 2s, right? Because that's statistically the highest amount of procedures that we do, which is true, is a class 2 composite, right? So, multiple crowns, endos, posts and cores, extractions. Like, I do a little dentures here and there. I don't really love doing it. Again, like, I've kind of moved away from that. I'm more on the digital side now, just based on the practices that I work. But again, like, that's what I'm saying is you can mold into what is interesting and exciting to you. And that's what's great about being a general dentist. That's why I picked general. What's one of the main reasons is, like, if it's something I'm not into, like, well, then I don't think my patient's best served with me then. Like, I'm actively telling you, patient, by the way, that's one thing for all new dentists to understand is, in dental school, we have this, it's a bad disease that goes around in dental school that I definitely caught too. It's called complexity-itis is what I'll call it. Complexity-itis. It's where we fall in love with complexity of a procedure. Like, what it's like going around your classmates. Like, what are you doing today, Taylor? I was like, oh, dude, I got this freaking crown I'm doing. Dude, it's going to be an EMAX on number 13, and it's so difficult because she's class 3 occlusion, and she's in overbite there. So, like, we're going to have to change the occlusion, blah, blah, blah. It's like, and then we use words like bread and butter to explain things that we think are easy. It's like, dude, you get paid the same. It's the same code. You know what I mean? Like it isn't like, who cares about the complexity? Not only that, it's like, you know what? If there's caries disease on this tooth and you are treating it, right? Like, that's a good thing. You should celebrate that. I don't care if it's a class 1 occlusal and that's not cool to you. Well, if it's not cool to you, then don't do it, right? Because you're probably not going to do a good job to you, or to that if you think it's boring. And so I guess passion is super important, in doing what we do. I think that does make good outcomes. Again, for me, like, I did general because if I'm not passionate about it, like, I'm not going to do it. And I tell the patient that too. Like, it's referring out is not me saying I don't want to see you. No, that's me actively saying I could make money on that procedure, but I'm actively telling you that I don't think I'm as good as the person I'm sending you over to at doing that procedure. And I want you to be good. So if you unfortunately, as the patient, I'm sorry, I know that's inconvenient, but just know that, like, what doctor have you had in your life that has actively told you, like, I want the best for you and I'm actively declining your money, right, and your time, right, so that you can be best served?
Hey, pretty much if you're still listening, really appreciate it. But, just circling back to what Dr. Barnett just shared with everyone, it pretty much goes back to 2 fundamental things that we should always remember. It's maturity and our own morality. That's pretty much what Dr. Barnett just talked about. It takes maturity to be able to ask people around you, hey, what could I have done better? Could I have done something different? It takes a lot of a test of your own morality. Hey, if the insurance is working out this way for a certain procedure and another way that way, am I going to pick what's best for me or what's best for the patient? So that's pretty much what this all is. And I think that those 2 things that you just talked about are really important and really mold the dentistry that you're going to be doing in your career. And Jordan, I really appreciate your time here. I really, really had a great time talking with you, and I'd love to meet you in person. Yeah, man, I really appreciate everything that you were able to share with us.
Yeah, man. If there's something that I'm not, it's perfect. If there's, again, I can cut crowns better, but I can't tell you how to cut the best ones. I'm still figuring that out myself. I'm not a perfect dentist. I have patients that can attest to that. I mean, it's just true, right? But I'm a caring dentist, and I'm one who's always looking to get better. And it's been, like I said, a tremendous year, and I've worked with tremendous mentors. It's definitely, it takes an army, and I feel like I'm building the best army. And anyone that, is committed to trying to be the best they can be and really just do the best dentistry that they can be, I think they're going to find real meaning in it. And I think they'll find
fulfillment.
Yeah. I mean, and I'm sorry, but like, if you're going to pay that much to learn a thing, I would hope that thing gives you that at the very least. I mean, like, mine came with a $500,000 price tag, like probably close to many of yours. And, I want to be able to pay it back, and I want to be able to live a life that I'm proud of and happy with. And dentistry has really offered that for me. And it breaks my heart to know that people in our field are suffering or having a hard time, right? And I just want to maybe be a bulwark against that the best I can. So, like I said, I really appreciate it, Teham. Iron sharpens iron, and so I really appreciate the opportunity to learn from you and with you as well. And as long as you commit to being a lifelong learner, which all of us do, that's what doctor means. That's what the oath that we take is, right? And then, look, things are gonna work out. If it's a job or if it's something that you need to figure out, like reach out. We don't have to. We're not in dental school anymore, or some of us aren't. And it's a big world, and there are people that do want to help you. You don't have to compete. Right? You can just focus on your dentistry and good things will come. Thank you, Teham. I appreciate it, man. And man, good luck to you, killing it. School does end, brother. To all of you listening, it does end, and it's a beautiful life. And praise God, and amen. And happy to help.
Thank you so much, man. Yeah, absolutely. All right, man. Appreciate it, and we'll talk to you next time. Take care. Bye.